very comprehensive introduction, Parminder. And thanks everyone also for joining us. I'm hoping we can have a productive session. And, obviously compared to like a year ago, we've had a paradigm shift in our life in many different ways. But actually some things have actually become a little bit easier. I mean, fortunately, like, most you said you have to go out, and fill in registration form, be in person, but, all we had to do really including myself, is just go online, click a button, and boom, we're here. Getting to know about this topic about fevers. I mean, for me, it's actually become a little easier. Just put on a little tie, don't even have to iron, just to make sure I have my polka dot boxers on, and I'm ready. So yeah, so for this, thank you, Corona. Thank you, COVID-19. On that lighter note, again, so this is the topic of all you need to know about fevers. And guess what? Most of this is going to be on COVID-19. And, the topic of fever is actually pretty expansive. And it can encompass so many different illnesses, so many different infectious things which cause fever, such as bacteria, fungus, viruses, of course, but obviously we're going to focus in on COVID-19 because this is unfortunately this year and or last year and this year also is that's basically been the news. Our life unfortunately has been revolving around this, virulent little viruses, and me among so many others of my colleagues have been on the front lines since the onset of this pandemic. And unfortunately, we continue to see the rapid effects of COVID-19. So from the perspective of a physician, also as a patient, because I was stricken with COVID-19 in April of last year, fortunately, I didn't do that bad, but unfortunately, I gave this illness to my wife, and she really took a hard hit. Fortunately, she did okay, but after 6 weeks of just symptoms and coughing and weakness and insomnia, saw the perspective as a patient, caregiver, and also one on the front lines of this pandemic. So unfortunately, again, we've seen for the past year that, all of us have really been directly affected by this virus. We all know loved ones who have passed away, and it still continues to cause paradigm shifts in the way we live in different ways. And going back, I mean, we remembered when it was on the other side of the world. We may have heard about this little epidemic, about these cluster of cases of pneumonia in Wuhan, China. And we're our medicine here, U.S., top-notch medicine care, excellent economy, politically we're sound. I mean, this is not going to touch us. We're going to be okay. And next thing you know is the number one cause of death in this country. In fact, number one worldwide. And this is just something which no one would have expected this. Not the leaders of the country, not the academics, not the medical experts would have expected this country to be suffering from this virus like we're doing. But it is what it is. So, as a physician, also, we've seen the evolution of knowledge and recommendations on how to treat this virus and how things have just continuously changing. I mean, this virus is just one step ahead of us, despite, the experts, those who have been who've been like experts in immunology, like Dr. Fauci, for example, who studied immunology for like decades. He's literally written the book on Harrison's. That's the Bible of emergency, the internal medicine. And even his recommendations, have been shifted because this virus, unfortunately, is one step ahead of us. It's been frustrating, right? But and we're getting tired and frustrated of, just dealing with this new life around COVID-19. But hopefully, I'm hoping we can, get some more knowledge about this pandemic to better equip us and better prepare us and our loved ones as well. So, in terms of this topic of fevers, right? It's not just about viruses. Number one, a fever is a rise of body temperature due to an infection. Now, not all fevers are due to infections. Sometimes, in rare circumstances, you can have other causes of fever, such as cancer, such as sometimes patients who are hypothyroid, thyroid issues, rheumatological issues. But vast majority of the time, when you have a fever, assume it's an infection. Okay, and most of the time, actually, pre-COVID-19, typically a fever would be, just in terms of statistics, would be like a benign virus, such as like a cold. And basically, just like take Tylenol a couple of days, you'll get over it. Maybe you'll have a sniffle, maybe you'll have a cough. Sometimes the symptoms will be much more drastic, and that's when patients, will go to the doctor, and if the symptoms are more severe, then go to the emergency room. So um, when you do worry, when you do need to worry about fever, is when it becomes really high. But that's when the chance that this could be something more serious happening, such as a serious bacterial infection. So bacteria are a common cause of fevers, right? And they can affect any organ, and most of the time the symptoms are going to be more focal. So if, for example, you have an infection in the lung, which is called pneumonia, you can have difficulty breathing. Often you'll have rusty or abnormal colored sputum. You'll have a bad cough, right? But you typically won't have like a runny nose. You won't have a sore throat. It's not typical in terms of a bacterial pneumonia, versus like viruses, which can cause symptoms head to toe. Similarly, bacteria which can affect the abdomen, like cause inflammation in the organs such as the appendix, or the gallbladder, or like the intestines, just diverticulitis. You would typically wouldn't be expecting to have like a sore throat, or scratchy eyes, or discharge from your eyes, like conjunctivitis, right? There'll be more focal symptoms in your abdomen. Similarly, for strep throat, it's not typical to get like a runny nose or diarrhea, right? It would just typically have so the symptoms of bacteria are usually more focal. Okay, so that's sort of, and that's important to get that addressed, because for bacterial illnesses with as opposed to viral infections, right? You need some more support. You often need an antibiotic. So that's important. Why, when you have any signs of a bacterial infection, such as pneumonia, strep throat, a skin infection, something severe abdominal pain with fever, that you get that urgently checked by your doctor, perhaps even in an emergency room. And even more so if there are other symptoms of like really high fevers, lethargy, and the like. Fortunately, bacterial infections of the brain are not that common. So meningitis, because of the advent of vaccines, have significantly diminished the incidence of like, meningitis, bacterial meningitis. And most of the time when we see meningitis, it actually ends up being viral. Okay. So, with the whole topic of fever, let's not forget about bacteria as well. And bacteria, as opposed to viruses, they're unicellular. They can replicate outside the host, right? But the way that they injure us and cause disease is often by excreting toxins and destroying and harming cells. Now, the fact that we're talking about COVID-19, it's also important to okay, so yeah, so for in terms of bacterial treatment, antibiotics are needed. You also don't want, the reason why you need to make sure you get treated promptly is that you don't want sepsis to happen. What's sepsis? Well, sepsis basically is when bacteria spreads through the bloodstream. And this can be bad because it can cause or injure your organs. So you don't want multi-organ failure. You don't want it to injure your kidneys, or other organs, and this can lead to possible disability and death even. So it's very important that the bacterial infection be contained, and that's why it's important to get that treated. And often antibiotic will be given by the provider. Now, if sometimes you have an infection and fever, it can be difficult to discern what's a bacterial infection and what's another, like a cold or whatnot. And that's when often patients will be given empiric antibiotics just in case this is a bacterial infection causing the fever. Because sometimes, fever from a bacteria can also cause symptoms of like malaise, flu-like symptoms as well from just the fever itself. So that can be like a little bit of a dilemma. But much of the time, the classic textbook bacterial infections would, you would have focal symptoms such as a sore throat for strep, uh, rusty sputum, and difficulty breathing for pneumonia, or difficulty urinating, and abnormally colored urine for a urinary tract infection, and so on and so forth. Now, what's a virus? Okay, well, virus is a little different than a bacteria. Bacteria actually is considered a living organism. Virus actually is not considered a living organism. It actually is like, it has its own genome, its DNA or RNA with a protein cover, as you see here in this picture. Okay, and a virus, think of this like it's really a parasite. Like a parasite, which, and the only way the virus actually works is within a host. So outside the host, a virus is basically has no power, right? And what a virus does is that somehow it attaches to the host cell and infiltrates it, and then it causes the cell to make more virus. Okay, so it basically hijacks the cell, and the cell is basically, we have different cells, and the cell is responsible for, maintaining itself and also certain bodily function. um, and so what the virus does is goes, infiltrates into the cell and inserts its genome, and basically somehow gets the cell to make more viruses to the point where there's thousands and thousands of viruses in the cell, and then the cell just explodes and releases thousands of viruses, and those viruses then attack other cells to make more viruses. And this is how like a viral infection occurs. Now, fortunately, we have an immune system, and our immune system is on the lookout for any foreign, you know, um, agents such as viruses, bacteria. Sometimes things we're allergic to also are perceived by the immune system as foreign. That's when we get an allergic reaction. But an infection and a fever basically is really a immune response to a foreign agent such as a virus or a bacteria, because that's basically that's the body aches, the fever, sometimes the inflamed lymph nodes. Those are all symptoms of, or that's when the immune system is activated and try to fight something. Okay, and so the immune system is the one which clears the virus, and most viruses, believe it or not, are benign because our immune system is able to clear it, but some are not, right? So common like viruses such as, we all know Ebola, right? Ebola is really deadly. Fortunately, it's not airborne, but it's pretty contagious, and it's like the mortality is greater than 50%. Uh, we Influenza is also pretty common. Fortunately, it's not as as dangerous. It can obviously adversely affect the elderly and also those who are immunocompromised. Some strains of influenza, historically, like for example, when we had the Spanish influenza, right? The Spanish flu in 1919, that basically the mortality was about 10%. I mean, 50 million people died just from that virus. So sometimes viruses can be really deadly, and that's what we're seeing again in this SARS-CoV pandemic. But typically, viruses can cause symptoms head to toe, okay, like a runny nose, sore throat, typical hoarseness, right? Laryngitis is almost like 99% of viral symptoms, 90, high 90s, it's a viral symptom. Muscle aches, right? Typical head to toe conjunctivitis, those are typically viral symptoms, okay? But again, there are some few viruses which can be deadly, okay? And but vast majority, fortunately, our immune system is able to clear them. Going forward, okay, so back to this whole topic of COVID-19. Okay, again, it started December 2019, right? And this new virus came out, and basically it's named SARS-CoV-2. Well, what about SARS-CoV-1? If you recall, 10 years or 15 years ago, we had the SARS virus. And this is actually more deadly than SARS-CoV-2. This was basically, we had also this originating in China. Some say also was related to the wet markers that were there. It still hasn't been ascertained, specifically the cause, but there are The experts have their theories. And anyway, this virus, basically the mortality was 30% and very contagious as well. Fortunately, I mean, the spread wasn't as much as drastic as this virus here. Obviously the mortality of SARS-CoV, I mean, one could say, well, it may be 1%, 2%, 3%, it may be 5%. It's really not specific because we still don't know exactly how many people have, the the spread of the virus specifically, beyond testing. But anyway, from December 2019, unfortunately, this virus really just spread, uh, so much, and now it's a pandemic. It is actually an RNA virus, basically meaning that all it does is just inserts its genome, and that's it. The ribosomes in the cell just replicate and just immediately start making the virus, and it just propagates. So in terms of epidemiology, in COVID-19, globally over 107 million cases have been confirmed. Again, confirmed, like testing. In the US, there's been 27 million cases, which represent 1/4 of the total amount of cases, which is just uh, so surprising, right? And 500,000 people, or close to 500,000 people, already have died in this country, which is huge. I mean, if you go back to to the Spanish flu, which 50 million people in the world died. At that time, it was about 750,000 deaths, and we may even COVID-19 may even eclipse that that number. So this is basically roughly 1/5 of the world's deaths are in the USA. Furthermore, seroprevalence surveys, right, suggest that the rate of COVID-19 infection is perhaps up to even tenfold. So whatever cases we're seeing are confirmed is not the actual, it's much more. Could be maybe 2 times, 3 times, 5 times, some say maybe 10 times. Okay. Going forward, transmission, spread. Okay. Okay. So it is primarily spread by droplets. Okay. And this was, again, when we were initially when SARS was the epidemic was coming about in this country, what was the first thing you heard about? Cover your mouth, right? Make sure you don't touch your mouth or eyes. But this was actually a little bit incorrect. It should have been more like put the mask on, and everyone wear a mask. And that was actually not the first information that even the CDC gave us, which is unfortunate. But this is the main mode of transmission. It's droplet transmission, micro droplets, much more contagious than the flu. It's been transmitted through coughing, sneezing, talking. I mean, the approximate range of transmission is about 6 feet, but it can be even more. If you're in a contained place, such as a home, such as a conference hall, then it can certainly transmit even more. And then we've seen that, like, for example, the amount of, you have the super spreaders and birthday parties and bars and conferences where entire audiences, entire attendees basically got sick. Okay, so this is an extremely contagious virus. So how contagious? Well, there was a super spreader event in a Biogen conference in Boston in February. There was 119 attendees. Okay, maybe, I'm not sure, maybe a couple of days or so. I mean, think about it. You're in a conference, you're sitting, it's a big space, but it's contained, it's closed, right? More than 6 feet. And in that conference, perhaps there was one person who had COVID. And that person transmitted COVID to all 119 attendees. And guess how many people did those attendees infected? About 5% of the population here in the US. That's 300,000 people, or at least at that time. So that's huge. So these are the super spreader events or occurrences which have happened here and elsewhere. So this virus is extremely contagious. Okay. I mean, we've heard the news about entire, people who go to like a birthday party in a bar, or spending Sunday in a choir in the church. All of them get infected, some of them dying. I mean, these are the super spreader events that we're seeing. So this virus is extremely contagious, and we know that. Not just that 6 feet thing, the social distance, that should be okay. It's that's those are loose, those are loose, like from the data, but it can be, obviously it's more contagious than that. Fortunately, well, in terms of transmission, in terms of infectivity, right? When someone gets infected, now going back in terms of the pathophysiology, right? When you get sick, right? When do you get a fever? The fever is when your immune system recognizes that there is a foreign body in your body. So that means that that's after viruses are already replicating, viruses are already in your system. So people who are infected with SARS-CoV before the onset of fevers can technically infect others up to 3 or 4 days before the onset of fever or symptoms, right? And that's what makes this, virus very difficult to contain, because you may feel, well, why do I need to wear a mask? I feel great, right? But then the next day, and that's actually how, I mean, me and my wife were already separate and, sleeping in separate quarters when I got the fever, right? But still, it was already too late, because it's, those few days before, when I was technically contagious, and others as well, right? And that's how, like, it's very difficult for anyone living in the same household not to get it if someone gets it. So, but the highest infectivity, when you get symptoms, you are 3 times more infective than when you're asymptomatic. So um, even though um, like, for example, children, fortunately, they have minimal symptoms, like minuscule symptoms. Sometimes, I mean, asymptomatic. So they may still be technically infected, maybe, but for a day or so, maybe for a few hours, until the immune system is able to just contain the virus and clear it. So their infectivity is low. They could still transmit it, certainly. So those who are asymptomatic, right, are less inclined to, proliferate the virus, but they're still infected. But those who have a fever, they are 3 times likely to, spread the virus. So those who have symptoms, body aches, whatever, they're very infective. So that's why it's very important for those specific. That's why we do the thermometer readings, right? And when we go into work and whatnot, this is just to, for the overall well-being of others as well. So mild infections, fortunately, transmission after 7 to 10 days is unlikely. So those who have mild symptoms of COVID-19, right, or any other virus technically, right, the likelihood to transmit the illness is unlikely after 7 to 10 days. Those are the ones who are a little bit sick, maybe a cough or congestion, maybe a little diarrhea, maybe a little loss of taste or smell, right? So those are less likely. And so 10 to 7, 10 days less likely. But there's many who continue to have symptoms for weeks on end, right? So fever is a very important, symptom to keep in mind. Incubation. Okay, so typically it could be up to 14 days, right? But most infections manifest in 4 to 5 days after exposure. So technically, you could still, like, it could take up to 10 to 14 days for an infection to manifest. It may take that long for the virus to get going, and to, be able to alert the body, or the body to be alerted that, oh, wait a second, I have this basically virus here, got to get rid of, right? That's when the symptoms of fever happen, whatnot. So it could take that long. But most infections, right, of COVID happen within 4 to 5 days of exposure. Sometimes a couple of days after exposure. If there's a lot, like, for example, you're next to a friend who's, been coughing a little bit. Now you're basically inhaling maybe perhaps millions of viruses, and you're going to get infected more quickly. Now, if you were wearing a mask, right, maybe a few viruses got in, and maybe, take a little longer for your body for the virus to replicate. That's why it's important to wear a mask. So, and it actually says, have shown that wearing a mask not only protects you, but also if you do get infected, it will make it less likely for you to have a severe infection. If you get a big bolus of viruses, it'll really, and this virus hits everyone hard. Most people it hits hard. I mean, people who've been healthy all their lives, then they got this virus, and they've been just for weeks just debilitated, weak, having chest pain, shortness of breath, all these symptoms you hear about. So even so, so those who do get infection, the mask is protective. So the amount of virus also you get exposed to is also uh, can determine how much of an infection you get. So the spectrum of illness is wide. Okay, I mean we can't predict. Like okay, I'm going to be fine, right? I'm healthy. I'm like 25 years old. I have no medical problems. You have an immune system. Your immune system is unique, right? And if you're not going to take the precautions, right? And if a virus is a whole bunch, if you're next to a person who's really infected and you inhale, get exposed to a lot of virus, is a potential you could get really sick. So the spectrum of illness is very wide. It can range from asymptomatic, like often the kids, to life-threatening. Like so, those who are 70 years old, right? Their chance of dying from COVID-19 is 20 times more likely than someone who is healthy. 20 times more likely, right? This is why entire nursing homes have been ravaged, just ravaged. So I mean, we've had elderly physicians in the hospital who passed away. It's really, I mean, it hits the elderly really hard. But there's also many who've survived and who did okay as well. So we can't predict what's going to happen. Versus like the common cold, even if you have, like if you're immunocompromised, your immune system typically should be able to take care of that. It's not something which is life threatening, right? But this virus really does a number. 80% experience mild symptoms, such as fever, malaise, myalgia, dry cough, diarrhea. Um, and A common symptom also is anosmia as well. It's pretty specific to COVID-19. It may seem benign, but there's many who've basically still continue to have loss of taste and smell after they recovered. I mean, my good friend of mine's, his sister-in-law's husband, he's still likes perfume. I mean, his daughter was just putting on perfume, he couldn't smell it. I mean, he's still like maybe 30% of his smell is there. 70% is lost just from having COVID-19, even though he did fine otherwise. So this virus can really do a number. So most experience mild symptoms, but again, really bad flu, like fever, malaise, fatigue. Common symptoms also are shortness of breath, very common as well. And 3 to 5% will have like lung involvement, like pneumonia and low oxygen level. Now, severe disease, again, it's when this virus hits the lungs. And this is when it causes something called ARDS, which is acute respiratory distress syndrome. This is when someone has ARDS, the mortality is very high. It's like up to 30%. Okay. And ARDS happens like this is when you have sepsis, when you have pancreatitis, really bad case, burns, and this is like an end pathway. Often the way that these disease processes cause death is that they cause so much inflammation in the lung, causing death. Okay, so ARD and these patients really they get ARDS very fast, and it's almost like it can be really devastating. And the way that COVID-19 kills people is through the lungs. Okay, not through loss of taste or smell, not through um, secondary infections, not it can cause blood clots, but that's not the way that vast majority deaths happen. It happens through the lungs. So the overall fatality is estimated to be between 2 and 3%. Again, a lot of variability in terms of who's affected. The elderly are much more likely, of course, but there's many young people, unfortunately, who've also passed away as well, and who are because of COVID-19. Okay, so the severe and fatal illness can occur in anyone, but the risk rises dramatically with those who are elderly and also a chronic illness such as hypertension, such as COPD, such as cancer, diabetes, BMI greater than 30. It just increases the likelihood that you may have a bad case of COVID. Okay, so going forward, um, diagnosis, COVID-19. Okay. The gold standard is the PCR. Okay, it's 95% if it's done the right way. So if you had a PCR test and you didn't feel anything, you didn't feel the swab going in your nose, typically it may have not, that may make it less sensitive. I mean, really, it has to like sort of tickle your brain a little bit. If you really feels horrible, that means that, okay, the nurse did a good job or the technician did a good job in doing the swab. Now, non-PCR swabs are good too. I mean, a positive test is a positive test. It's unlikely to be a false positive. I mean, there have been cases of that, but that's possibly the lab screwing up. A negative test, however, if it's a non-PCR test, can have maybe like a variability of 10 to 15% sensitivity. So is 10 to 15% of the time it could be a false negative. So that's important to know. And even sometimes we see in the hospital where the PCR test also a patient may need a couple of PCR tests to confirm the diagnosis. But we are getting it is getting a little more sensitive though. So if the patient has a fever, if they're COVID negative, and they don't have any other symptoms, lungs okay, typically we assume that they're not COVID. Okay. And actually, our hospital, Valley, like other hospitals, I'm sure as well. I mean, we really take a lot of effort from the get go in, making sure everyone wears a mask. Anyone who comes in who has those symptoms gets into an isolation room, gets COVID tested, and we do the precautions there. So, in fact, the hospital may even be more safer than your local, grocery store or whatnot, because everyone's obliged to wear a surgical mask, right? And also we separate patients as well. So I know before, like in the pandemic when we had the first 2 months, hospital was a dangerous place to be, but we've done we've really now, like, I think made great strides in ensuring safety of patients, of COVID versus others as well. Anyway, going back to diagnosis, right? um, if you have someone, if there's someone who is COVID positive in a home and there's others who have symptoms, the assumption really should be that they also have COVID. Okay, they don't necessarily have to be tested. I mean, if they're doing okay. Again, another very specific symptom of COVID is the loss of taste and smell. Um, Now, in terms of the workup of COVID-19, it is actually pretty simplistic. It is not brain surgery. All the most important really variable is your oxygen level. I mean, you don't need to do a CT scan of the chest. You don't need to do blood work to see whether there's a blood clot. You don't need to do all this stuff. I mean, it may help you in stratifying or risk stratifying and make sure there's other diagnoses, but the chance that you have, if there's someone who's COVID positive, the chance that you have another bacterial infection is very rare. It's really COVID. Yes, those who warrant admission, they get anticoagulated because they're higher risk for blood clots. Um, and again, if they do need oxygen, they get oxygen. Often, if those patients have really horrible looking x-rays, there's no need for a CAT scan. X-ray just in and of itself is very useful to sort of risk stratify how is this patient going to do. So if the patient has comorbidities, like if they have emphysema, they are morbidly obese, and they have a very bad looking x-ray, even if the oxygen looks okay, then at least we can be very aggressive in terms of trying to help them and do other therapies perhaps to reverse the trend. And the thing is that there's really no cure for COVID. It's really supportive care. It's really so, and this is the most frustrating thing for as us physicians. Really, many times, many of these patients, we can do little except for give oxygen. Okay, yes, steroids may help. Yes, some of the antivirals may help, but they're not curative. It's really supporting the patient until the immune system is able to clear the virus, and that's what's going to get them better. That's what's going to clear the virus, the immune system. And unfortunately for many, it's too late. When the lungs are affected, when the oxygen level is too low, It's we're already behind the eight ball. So those with severe hypoxemia are at higher risk for death. Okay, so those who present with an oxygen level, for example, of 70%, right, on 100%, it doesn't look very promising, particularly if they're very elderly. I think I'm ahead of myself in terms of okay. Okay, so supportive treatment continued. Okay, so just make sure I didn't miss a slide. I did. Okay. Okay. Just one click of the mouse, and I'm like going 2, 3 slides down. So oxygen therapy. As I mentioned before, COVID's injury to the lungs is what kills. Okay, so the most important variable, right? Even if you have mild illness versus severe symptoms, is going to be your oxygen level. That's what I'm going to look at. Okay. Do you need to be in the hospital or not? It's typically the oxygen level. So if even if you have spots in your both lungs, or if someone has spots in both lungs, if their oxygen level is okay, 98%, and if they're able to walk okay, and there's still the oxygen level is above 95%, it's unlikely that you need to be admitted. Okay, because admission also it will be unnecessary. Hopefully those patients will do okay, because many have findings in the lungs, and they'll eventually recover. But when the oxygen goes down, when you're breathing fast, when patients are breathing fast, then those are indications perhaps that they may need to be admitted for monitoring for deterioration. Okay, so those who develop like COVID pneumonia, like, so ARDS happens or develops in a significant amount. They're estimating that 42% develop COVID pneumonia. Okay, and 60% require ICU care. Okay, and what's given to them? Well, it's oxygen. Okay, severe hypoxemia, we use high flow nasal cannula. We try to avoid putting the patient on a ventilator. When patients are put on ventilators, bad things can happen. Further lung injury, additional infection, and the chance of mortality and morbidity actually increase. So we try our best to avoid even those who have really low oxygen level to be on a ventilator, because often they're not going to be able to get out. But for those who are like young, who have a chance, and that's the last straw, yes, then yes, they perhaps then we do ventilate them, but it's really reserved for the sickest, those who uh, cannot be oxygenated by non-invasive means. Going forward, I know that cover some more slides. So supportive therapy. Okay, we have supportive therapy. I mean, we have monoclonal antibodies, but don't. I mean, I know there may be some hype, but unfortunately, right, there's really not much data to support that it does much. I mean, with patients who have minimal disease, it may help a little bit. It may risk stratify some to do a little better or to prevent some admissions, but it's not like, a cure. It's not something which is really, you should rush out for. It may help some, but often it doesn't do much, unfortunately. That's what the studies have showing. Similarly, the convalescent plasma, for some people, if you get it within 3 days, there is a trend to improving. A trend, as I mean, it is improving, because most patients actually don't appear to benefit much. In Valley, we try to give it within 5 days. It's worth a try. These are the sickest of the sick who have bad pneumonia. Remdesivir does help a little bit, particularly given within 10 days. It does help a little bit more than convalescent plasma based on this data. So we try to give it with those who are admitted or have onset symptoms within 10 days. Studies show that it does help within 7 days. So, that's what Valley does. Reasonable measures. Steroids appear to also help as well. And there's other, like this medicine with the B, monoclonal antibody as well, which can be used. But again, these are just supportive therapy. This is not the cure. And so, putting everything into perspective in terms of therapy, I mean, the optimal approach is really uncertain. If you ask like 3 pulmonologists or 5 pulmonologists, okay, how do you treat COVID? You're probably going to get 5 different answers, okay, because we just don't know, and theories are still evolving. And the frustrating part is that, you know, many times a specific therapy may not work. Maybe there's a trend for some therapies to work, and that's why we've instituted the plasma, the steroids, the remdesivir, the antiviral, and there is a trend that does help those sick patients. Okay, but it's still not the cure. Okay, so no other therapies really, with what I've just mentioned, have really clearly proven effective for COVID-19, which is very frustrating, particularly as physicians, because I mean, what more can you do in terms of give oxygen, which and just to reassess patients. Okay, so it's really this virus has really hit us hard, and it also hit our egos hard too, in many different ways. Because despite our level of medical knowledge, expertise, and healthcare, we were just this virus is really just sucker punched us in many different ways. So it's really the immune system, just supportive care until the immune system can clear this virus. Okay, now for those who have mild illness, who are at home, okay, again, supportive care. Give them the Tylenol. Yes, there is some recommendations to avoid ibuprofen or NSAIDs, but other studies have shown that it's really not harmful. So if you need to give it, you can give it. It's not going to make things worse. And rest is very important. Many just try to do normal things, and they basically get winded. They get chest pains, shortness of breath. I mean, I've seen so many patients with COVID, mild COVID, like symptoms, who are just doing trying to do everything, trying to normalize their lives too early. And this virus really um, uh, hits you hard. Okay, hits many people really hard. I mean, but fortunately, those who are stable, who don't have a low oxygen level, who are weak but their oxygen level is okay, they're not breathing fast, rest. There's no need for anticoagulation, even though yes, COVID-19 does increase the chance of clots. However, those are in the sickest of patients. Do buy a pulse oximeter. That's important to make sure that you're not progressing or interval getting progressive worse in terms of COVID-19, right? That's important because that is the number one thing that we'll look for. Is your oxygen level low or normal? Because that may determine whether you need to be in the hospital. And again, it's important to separate from other hospital members, even though they may already probably are sick. But again, N95 would be recommended, or a surgical mask. One thing I may not have mentioned is that in terms of masks, I would advocate using a surgical mask. I mean, what's the use if you're using a cloth mask and there's still a chance, right? A certain percentage of getting the virus and spreading it to others. I mean, it doesn't really, I mean, why do things like a halfway? I mean, that should have really, I mean, one gripe I have with the CDC is that why did they not advocate surgical masks from the get-go? Yes, I understand there was a shortage, but now it's like it's available. I mean, go to any convenience store, you have a surgical mask. It should be worn. Uh, don't go for less than a surgical mask if you have not had COVID, if you have not had antibodies, because you can easily get it. Breathing through a cloth mask, it's the whole there's big holes there. I mean, the viruses are tiny, tiny. You know, so use a surgical mask if you are in a obviously like place where there is someone who has COVID and you don't have it, you should go and get an N95 mask. Okay, I mean, they are available for, I know there's still a short supply, but at least the very least a surgical mask, particularly in those areas where um, it's transmissible, with like convenience stores and airports and whatnot. Frequent hand washing, obviously, for all family members. You do not need to go crazy with the Lysol, right? Even Dr. Fauci, basically he says that what he does is that when he goes into the house, he makes sure he washes his hands, and then goes about his business, because even if you wear gloves, you're still going to contaminate yourself as you're going inside your house. So the most important thing is, as you go inside the house, clean your hands very thoroughly, and that should be sufficient to if you have touched any contaminated surfaces. Going forward, post-COVID symptoms, okay, as we're sort of like rounding third base. So this is also one very frustrating part about COVID-19. I mean, just for example, my wife, I mean, she basically dealt with like shortness of breath and chest pain. Hopefully this is not a HIPAA violation, but I'm just saying that, and she never really got sick. I mean, yes, maybe a cold here and there, maybe flu here and there, but I mean, to the point of difficulty breathing, they had a cardiology evaluation, everything was okay. It's all COVID. Fortunately, she's better. And I've seen so many patients like that, chest pain, shortness of breath. They've had COVID 2 weeks ago. And so this virus really hits your system hard. It takes time many times to recover. Fatigue, difficulty breathing, chest pain, okay, persistent cough. Annoying thing is, again, the altered smell and taste. It's not worth getting this virus. Protect yourself, wear a surgical mask, and be smart. Do not let your guard down. And if you let your guard down for like even like a split hour or so, that can result in COVID. And some people have persistent symptoms, unfortunately, which last for several months, particularly those who have been like hospitalized as well. So these are the constellation of post-COVID symptoms going forward. So some questions, right? What if my COVID test is still positive? Well, that's important question. And sometimes, unfortunately, we tend to go a little bit overboard. Okay, do I need to? I just want to make sure I'm out of COVID. Just I need to check. Well, if you've had COVID, really, and as per the CDC, it does not recommend repeat testing within 3 months, even if your employer wants that, right? Even if a family member wants you to make sure it doesn't, I mean, if you're symptom free for 14 days, you're definitely not COVID, technically, right? If you haven't had fever in 14 days or symptoms, like, you're good. It's not, and you're gonna be positive. You may be positive to 3 months, and that's just gonna cause more headache and anxiety and for everyone, including others around you. So it's not really needed. Unless, however, of course, if you're immunocompromised, if you're having a recurrence of symptoms of fever and cough, then perhaps, because there may be a chance that the immune system didn't clear it. And that doesn't happen for majority of people. Majority of people, 90, I mean, like, for example, after having COVID, if you're clear, resolution of symptoms, um, in I mean, up to 6 months, people are protected from repeat infection. 95% are protected. Okay, there's obviously that certain amount who may fall in the exception range, but vast majority are up to like 6 months. Now, after 6 months, we don't know. That's the caveat, right? Um, okay, going to training to quarantine and isolation. Okay, another frequent question. So, and again, the guidelines are changing. I mean, for sure, 14 days is enough after you have like resolution of fever and symptoms. But obviously, for many, this is like too long. So for symptomatic patients cared for at home, right, isolation can typically be discontinued in general when there's at least been 10 days since the symptoms first appeared, and there's been at least 1 day, like when there's been resolution of fever without any use of Tylenol or Motrin or ibuprofen. And also there's improvement in symptoms. So we've basically lightened the criteria for quarantine to make it a little easier. And this is also okay as per the experts, right? As per like because now we've been a little less strict, because now we know more about what's going on with COVID infections and post-COVID and whatnot. In COVID positive patients without symptoms, isolation can usually be discontinued after 10 days from the positive test, as long as there was no evidence for subsequent illness. Okay. But for those who have severe disease, then isolation may be needed. Going forward, uh, COVID. Okay, and just FYI for the CDC, they still recommend a 14-day isolation. However, they're also okay with shortened quarantine for asymptomatic patients or individuals of 7 days following a negative test or 10 days without testing. So again, we've been a little bit more lax, and you can use these guidelines as well for yourself and fellow loved ones as well. Going forward, as we're running third base. Prevention, again, as I said, is better than cure. Okay, prevention is better than cure because there's no specific cure per se when you get infected, other than your immune system, other than your supportive care. Just wait for your immune system to rev up. And again, we don't know how. It's variable, like how this virus will affect someone. Okay, someone can have no medical problems and it can kill someone, right? Versus um, I mean, most people do fine. I mean, 80% or so do fine, but there's still, like, we don't know how this virus, like maybe it can hit you and the immune system can't respond, whatnot, and then you get a severe infection. So prevention is better than cure. Wear masks, obviously, surgical masks when in public spaces or around individuals outside their household, because we don't know who's an asymptomatic carrier, right? Which type of mask? I've mentioned that, right? Surgical mask. The rationale for all individuals to wear a mask in the community is, again, to protect everyone, right? Um, and proper hygiene is important as well, but you don't have to go, like all out with the Clorox wipes. Bleach. It's not really gonna increase the or decrease the spread. The main mode of spread is, again, droplet, okay, droplet. Okay, I'm gonna sort of. Uh, You mentioned that. Sorry, my mouse is sort of acting up. Apologize. Okay. Okay, vaccine. So we have many different vaccines on the market, right? We have Moderna, we have Pfizer. Listen, if you can get a vaccine, get it. Okay, because the thing is that, yes, even if you had COVID, you don't know how long your immune system is going to protect you. Okay, I've seen a case where a patient was infected in, like, when it started, like in February. She had the antibodies, and now, just I think last month or last week or so, she basically came in with her whole family got COVID, and she came in with a couple of days of body aches, and lo and behold, she's positive. So the point is that she's young and healthy. I mean, but this is a young, healthy person who, I guess at this point, has lost antibodies, and now infected with COVID again. So we don't know how long the antibodies last. For sure, they last about 5, 6 months, but after that, we don't know. And that's why we get immunized, for example, for influenza. And so it's important just to protect yourself. Obviously, if you've had COVID recently, within 3 months or so, is it 3 months? 3 months, then you probably should wait, right? Or if you have, like, some allergy to, like, for example, like polyethylene glycol, and it's a contraindication for that. Everyone else really should get the vaccine. It's safe. It's an RNA vaccine. Oh yes, every time you get a vaccination or medicine, there's always a chance for allergic reaction. But still, even having an allergic reaction or anaphylaxis history is not enough to say no, you should not get the vaccine. Because again, COVID can kill, right? It's killed already 500,000 in this country, and it doesn't look like it's letting up anytime soon. Okay, so it's very important to vaccinate. Do not believe the hype of not vaccinating unless there's legitimate reason. Now, even if it's the DNA vaccine, which has 70% efficacy, the RNA, the Pfizer and the Moderna have about 95%. Um, and pregnancy is not also contraindication of vaccine. You can also be pregnant, and you can also get the vaccine as well. In fact, that virus hits pregnant patients also pretty hard as well, so it can kill. Even if the pregnant patients are pretty healthy, but it can certainly hit them pretty hard. Sorry. Okay, some uncertainties. Unfortunately, recently we've had the emergence of resistant strains. There's the British variant. It appears that at least Pfizer and I think Moderna also are able, I mean, are effective. But then there's now this old issue about the South African strain, and this is actually, very disheartening because, when Dr. Fauci says now, basically just assume that you're dealing with a variant, right? A mutant, basically. Now, basically, we go back to square one. If Moderna vaccine, if there's preliminary reports of Moderna and I believe also the Pfizer are not as effective against this South African strain, it's pretty disheartening. So we have to go back to square one. And again, no one anticipated, the experts did not anticipate the virus mutating so much that this protein, right, the protein which is an essential part of COVID 19, right, that this would, like be less effective. And this would mutate so fast that even it can bypass these vaccines which have been made. So it's pretty disheartening. So again, this shows us that this virus is still one step ahead of us. Okay, and even the experts have been baffled, and they continue to be baffled with this, this virus which continues to cause havoc. So there's still a lot of uncertainty, but still do what you can do. Protect yourself with a surgical mask. If you can't, still get the vaccine. Still get the vaccine. It's very important. It can save a life, and it can save others as well. Because there's obviously a lot of uncertainty out there. When will vaccines actually result in herd immunity? We don't know. Hopefully soon, but it may take some time. What is the impact of mutated strains of COVID-19? Obviously, the potential for more grave situation is there. But again, the more that people protect themselves, use the vaccine, and get protected, this will minimize that impact. Okay, so the future is uncertain, but again, and do not assume that COVID-19 will go away soon. We've made those so many assumptions again and again and again, and COVID-19 again has continued to be one step ahead of us and has proven us wrong. But hopefully, if we do our thing and be patient and persevere, I'm hoping, be hopeful that we will get over this pandemic, and hopefully, we're hoping that this pandemic will end, God willing. Again, I apologize for the I went a little bit overboard or over my time in terms of Q&A, but hopefully we can do some Q&A. Perhaps you can entertain the questions you have.
Hi, Dr. Ranginwala. There are a couple questions here. First question, any concern if you have a fever for 48 hours, reaching almost 102 at its peak, but no other symptoms and tested negative for COVID-19 5 days later? Felt completely fine other than fever making you tired and headache, and nothing prior to or after the fever subsided?
Yeah, so I mean, it's not uncommon to have like fever for even sometimes a few days. 102 is, I mean, it's not 103. 103 is typically when it technically is a high fever, but it also depends on like, are there any is the person immunocompromised? So if they're immunocompromised on chemotherapy, their immune system is already weak, and there is a chance of a serious infection. I mean, if it's COVID negative, I would assume that's probably not COVID, but like if they're healthy, if there's no, they're not on any immunosuppressants, they typically a couple of days of fever. It's usually not a big deal, and just basically monitor for other signs and symptoms. But if there's lethargy, if there's like some focal symptom like severe headache or severe abdominal pain, difficult breathing, then they should definitely get checked out. It's always, it won't hurt to get like an evaluation, but for the most part, fever of a couple of days, even 3 days, and it resolves. Usually, it's a benign virus, and the body is over it.
Great, thank you. So just a reminder, if you have any questions at home, please send in your questions. So I have another question here. What temperature should we treat a fever at?
So that's a good question. Technically, I mean, when we're like a fever is like 100.4. but many times you can have a fever of like 100 or 99.9 orally because oral temperature is not as accurate. But if you have, um, again, remember, you're just treating the fever. You're not necessarily treating the cause of the fever. But many times, it's not going to hurt. Treat the, it makes you. Many times the fever response is very annoying. It can cause a lot of headache, body aches. To go forward and just give some Tylenol often helps. Helps in terms of just feel the better. So remember, just keep that in mind. You're not really treating the cause of the fever, but you can give a Tylenol or a Motrin for like temperature of like 100.4 for sure. But if it's 99.9 or 100, that shouldn't be a problem too, because that's probably a fever as well. Most of the time, if there's any question, like for kids or whatnot, I mean, obviously, who likes the rectal temperature? But that's like, I mean, if there's any question, like, we can always do that, but that's obviously who does that.
Great. Next question. My 19-year-old went to an allergist, found out that she cannot use ingredients that have propylene glycol in them. Does the vaccine have the ingredient in them? And should she then not get the vaccine? She has mild asthma.
So that's a good question. I would probably defer to the allergist in terms of what the allergy is, but yes, the Moderna and the Pfizer vaccine do have that, and that's actually the usually the cause of like those cases you have of anaphylaxis. I mean, if it's a mild allergy, I mean, I would sort of defer. First of all, 19-year-old, so it's like like they're recommending for the vaccine basically those who are under 17, I think. So I mean, I would sort of defer to the allergist in terms of like, I mean, whether she can actually go forward and use the vaccine. I mean, if she has like a more than just like a rash or so, I would recommend not to get it. Number one, she's 19, so she probably will do fine anyway, right? Because the chance of her having like, God forbid, hopefully from COVID, it's all benefits risk. So,
Okay.
but allergy in general, allergy to polyethylene glycol would be a contraindication. But I'm not sure exactly what the extent of the allergy is. So I would sort of figure that out. If it's like a prominent allergy, that's probably already like she probably. I mean, there's again just soon. Hopefully, we'll have other vaccines as well. I mean, there's one which is a DNA vaccine, which is also being developed as well. I mean, it's on the horizon. So
Great. And then there's one more question here. Is raw honey good to boost the immune system?
yeah, honey has actually a lot of benefits. It actually helps a lot in terms of cough. From my limited knowledge, I believe it also can, like help the immune system as well. But certainly it's something which is natural. It's sweet. It's really helps like URIs as well. So yeah, go for it. It's something healthy and natural.
And I think that's all we have today. Just give one more minute to see if anyone wants to send in. Oh, here's one more. My neighbors ask me to watch their dog when they go on vacation. Is it okay? I guess in the sense of,
Yeah, I mean, if the I mean, for animals to spread COVID is unlikely, but I guess it is technically possible. But if the neighbors don't have any symptoms, I don't think there'll be a problem in general. Um, you know,
okay,
Fortunately, I mean, I guess there've been I mean, I know that there's been animals or sort of like I think, but it's for the most part it's human beings. If they're not symptomatic, the likelihood is rare, in my opinion. So I don't think it'll be a problem.
great.
Yeah, it doesn't sound like one.
And um, is it okay to be on a bus, a small bus with 7 kids under the age of 14? Well, I guess that would probably, I'll let you answer that.
Yeah, I mean, if you're on planet Earth, basically, unfortunately, you're at risk for corona.
Yeah.
So, and I mean, the thing is that one thing we have to also do is try to get on with our lives as well. And that's why we have all these different criteria. The best way to protect, fortunately, we can protect ourselves with again, a surgical mask. And so if you're in a area, I mean, again, kids, uh, the challenge with them is that they can certainly get infected and they can feel just fine. Like my kids, I'm pretty sure they were really exposed, but they had almost nothing, fortunately. But I'm very sure they were very exposed when, when our house got corona, and many others probably as well. Um, but yeah, they could certainly be potential vectors for spreading it, but it, as long as they, I mean, you have to put, bread on the table. I mean, somehow, I mean, you have to get on with life. I mean, I think that she should be okay if she, wears a surgical mask. Shouldn't be a problem, but a surgical mask, because you're in a, confined environment, and um, I mean, you don't have those microscopic eyes to see, okay, who has COVID, who has not, who doesn't.
Yeah, so I guess the key is to make sure we're wearing those surgical masks. And I also know the last day or so that the CDC is recommending double masking. So
I mean, yeah, you could do that too. If you, I mean, for the most part, like, look, I mean, in the hospital, everyone has to wear a surgical mask, right? And this is like also other places too. I mean, so I think if you wear appropriate surgical mask properly in general, and if you're dealing with people who are not symptomatic, technically you should be safe. Is there a 100% guarantee? There's no 100% guarantee in life, but you should be safe. I mean, so that's basically all you could really do. I mean, look, there's been doctors who are extremely careful. I mean, who have been like gowning up, Ebola gear, anesthesiologists, same thing, and they've got COVID. I mean, so many I mean, this is such a contagious disease. But those doctors are dealing with the most infectious of patients who are just like, just surrounded with COVID. And despite what they're doing, I mean, they've gotten COVID. I've known multiple coworkers, who I know they're just like doing the best they can, and they're doing even exercising more precaution than myself, And so this is like every place, every hospital. I mean, pulmonologists, just anesthesiologists, ER docs, nurses. I mean, it's really, I mean, hit us hard. But as I said, just we have to, like, just get back up. And but you're typically in the low risk patients, like low risk asymptomatic. Surgical mask in general is protective. If you're still concerned, you can always try to go and purchase the N95. That's better. KN95 is also just good. Maybe the seal is not as, as great, but it's still even better. So
great. Thank you so much, Dr. Ranginwala.